Hi, everyone. I'm Ben Swett, the editor of the SeniorCare Investor, and today I'm joined by Scott Tittle of VIUM Capital. Welcome, Scott.
Hey, Ben. Good to be with you today. Thanks for having me.
No, thanks for taking the time today. Today we're going to kind of talk about the regulatory environment and any possible effects that it may have on M&A in the senior care market. But I first just wanted to kind of touch on your own background and your new role at VIUM.
Yeah, thanks, Ben. And this is our first opportunity to talk, and so good to meet you. Certainly here on video. Yeah, I'm really excited about my new role. I've been with VIUM Capital for just about a month now. I've been in the long-term care space for just over 15 years. I'm a lawyer, healthcare lobbyist from Indiana, and I've been doing a lot of work in and around the sector. Here, I'm working at my home here in Carmel, Indiana, right now. Started my long-term care efforts really when I worked for Governor Mitch Daniels, and I was his first healthcare policy advisor here in Indiana. And we created the Division of Aging as a separate standalone state agency. And then, like a lot of people, went through a pretty difficult personal experience with a family member who had advanced Alzheimer's and had to be moved in a facility. So I became very passionate about long-term care and the quality of care, and certainly the commitment of the staff to residents and families. So that was about maybe 17 or 18 years ago. And then when I was a lawyer in private practice, had the opportunity to work with a number of long-term care operators here in Indiana. And through that effort, got to know the Indiana Healthcare Association, which is the state's largest trade association here in Indiana, representing operators, both skilled and AL. Then transitioned from my role in private law practice to become the president of the Indiana Healthcare Association and the Indiana Center for Assisted Living, and served as really the state's chief lobbyist for the sector for 5 years and running the trade association, which I absolutely love. And then 6 years ago, had the opportunity to come out to Washington, D.C. and work with Governor Mark Parkinson, who's the president and CEO of ACA NCAL, and worked with he and the executive team there in D.C. for 6 years as the executive director for the National Center for Assisted Living. So the last 6 years, I've been focusing almost 100% of my time on our assisted living side of the continuum throughout the whole country, and working with all of our state affiliate chapters. So that's been a tremendous opportunity. I found myself on the road quite a bit. As your listeners know, assisted living is licensed and regulated at the state level, and to the extent there is Medicaid waiver, state plan reimbursement, that's also through the state. So I found myself traveling state capitals just about every week. My kids are young, and wanted to find an opportunity to kind of be at home a little more, but still feel like I was adding value and providing service to the sector, and got to know the great team at VIUM when they were with Lancaster Pollard over the last 10 years. And it's been a great opportunity to join this new company, which was launched in April of 2020, and serving as their first head of government relations and external affairs. So it's been a great month, and good to be with you today to talk about what's going on in D.C.
Yeah, it seems like a great addition at VIUM, especially, they had a great first year in business, and 2021's been fantastic so far. So it seems like a bright future for all of you there. So just diving into DC, I just wanted to get your thoughts on the latest round of provider relief.
Yeah, and certainly, and I mentioned certainly as in my role as here at Government Relations, I think Government Relations External Affairs for VIUM, I'll be working with our senior team and our board and some of our outside partners, affiliate entities, on kind of what's going on in DC, but also piercing through our clients as well, and providing some guidance direction on what's going on. So I just came back from the ACA NCAL annual convention in Washington, D.C., so kind of hot off the presses with some of the most up-to-date information and news. Yeah, the Provider Relief Fund has been, certainly as I think about the last 18 months, the role I played at ACA NCAL, the collaboration between all the national trade associations was really penultimate to get this fund really up and going. The Trump administration reached out to all the trade associations, back maybe in March or April of last year, to let us know that Congress would be allocating some significant funding for some stimulus relief, but they needed our help. And so we combined forces and resources through ACA NCAL, Leading Age, Argentum, ASHA, and NIC, and met just about every day there for a while, if not at least weekly, to kind of talk about what's going on in the sector, talk about what our members are going through COVID relief, COVID challenges, and then figure out how best to kind of help formulate the program as best we could, certainly in giving the Trump administration as much guidance as we could. And through that effort, certainly we're able to secure quite a bit of funding through the prior distributions through phase 1, phase 2, and phase 3. To date, before phase 4 was released, we think there was about $12.5 to $13 billion that went out into the SNF sector, and just about $1 billion in the senior housing. And so I give you that context and perspective that phase 4 is certainly much needed and welcome. The amount of funding that's put forth through phase 4 matches largely what was phase 3, about $24 to $25 billion. The concerning thing certainly is that it's been since really December of 2020 that any money has gone out largely from the fund, other than some corrections or some delayed application distributions. But really in terms of a large distribution, it's been really since December. And I say that also in context because the expectation is the money in phase 4 probably really won't go out until November or December of this year. So really providers that will benefit from phase 4 and that were able to benefit from phase 3, it'll be a 10 to 11 to 12 month gap between those large distributions. And as we all know, Delta was a significant, it had a significant impact on the entire sector. And so certainly the money is much needed, absolutely much needed. The terms of the distribution are pretty similar to phase 3. Phase 3 provided an opportunity for coverage for lost revenue and expenses for quarter 1 of 2020. And the way they used the formula was they asked applicants to go into the portal and put in your lost expenses and revenue based on your prior expenses and revenue from the 2 quarters of 19. So comparing quarter 1 of 19 to quarter 2 of 19, and then quarter 1 to 20 and quarter 2 of 20. So try to create a COVID baseline, if you will. Similarly, on phase 4, they're using a very similar effort where they'll be looking at the last 2 quarters of 20 and the first quarter of 21 as a potential quarters to cover those lost revenue expenses, and asking providers to look back a year before and create a similar baseline. The formula has not been yet determined. On phase 3, it was 88% of that lost revenue expenses, the delta between those quarters, the base quarter and the COVID quarter. And so the formula has not been yet determined. HRSA has indicated that they will likely provide a higher percentage to smaller providers, and the recognition that smaller providers have certainly been impacted significantly during this Delta experience. The application portal is open. I think it opened at the end of September and goes to the end of October. So I encourage all the listeners to make sure that they're going onto the HRSA webpage. They've had a number of webinars on giving some guidance direction on how to apply. The next one, I believe, is I think it's in October, sometime in here in October 24th, 25th. And I would really encourage operators to make sure that they're either pulling down those past webinars or participating in that one coming up before they hit send on the application. So again, a long way of saying the context is really important to understand phase 4. It's much needed. But I would say probably, and again, I'm just coming off of the ACA-MCAL annual convention, the word on the street was kind of the funding is certainly needed, but certainly short term, probably would last maybe 3 to 6 months for most providers. Our hope is that another round of funding could be coming, although there's no definition or no time frame for that. I think a lot will have to be seen with what happens through the infrastructure package and going into the next calendar year. If another wave of COVID comes through, how operators largely perform towards the end of this year. So I think certainly the full effort is to make sure that phase 4 gets out timely, gets out in a clean way. One more thing I'll add too, to make sure your listeners our watchers, viewers are certainly aware of. Phase 4 did provide some additional, the phase 4 release, did provide some additional detail on the phase 3 distribution. So for those providers that either got denied outright or maybe got a payment that was significantly less than what they expected, there's more detail now on how they actually distributed phase 3, and there's actually somewhat of an appeals process for phase 3. So I would really encourage operators to review what they received on phase 3, compare it to what's in the current phase 4 package detail instructions, to make sure if there is an opportunity to then pull down additional phase 3 dollars that they're going after that. Similarly, there's an appeals process under phase 4 as well, which was much needed, and that was a recommendation from all the trade associations to the administration going forward. So again, one long run-on sentence about phase 4, but I'll say it's much needed. It certainly is not going to cover all of the lost revenue and expenses that operators have realized over the last 12 months, but certainly it's helpful in the short term, but we're hoping that there may be more funds to come in the future.
I'm just curious, are there any drawbacks for providers to apply for this relief? Like any reason for hesitancy?
I would say I'd say no, largely, Ben. But certainly there are some things that people need to keep on the radar. Skilled operators, because of their historical relationship on the payment side with CMS, are used to these audits on a go-forward basis, right? Now, certainly you need to be very mindful if you're a recipient of the terms and conditions of uses of the dollars and appropriate use of the dollars. So I didn't mean to say certainly there's no concern. Obviously, having an internal quality control program to make sure that the dollars are being spent in accordance with the guidelines of the payment. Significantly important, certainly on those audits, so you don't have any potential opportunity for a clawback or even in some kind of additional penalty as a result. For skilled operators, though, excuse me, for assisted living operators in senior housing, though, it's certainly, this is a new experience, right? This is a new relationship that that the senior housing space is going to be having with CMS on the payment side. And so AL operators certainly should be mindful on making sure that they have a good quality control program to make sure the funds are being spent in accordance with the guidelines of the distribution, so that they don't fall into some significant concern of a clawback or any penalty. So I would say for those senior housing operators, certainly it's something to be very mindful of and be very aware of and prepare for. And I'm just going to quote from the, and I know one thing that's certainly top of mind for a lot of operators, especially with a lot of the M&A activity, is are there any enhanced opportunities for or concerns for audits with any M&A activity or acquisitions? And I'm just going to read from the press release specifically. It says, providers who report a merger or acquisition may be more likely to be audited to confirm their funds were used for coronavirus-related costs consistent with an overall risk-based audit strategy. So I would say for those operators that maybe had some significant merger activity during this phase, to certainly have your radar up.
Mm-hmm. And do you expect seniors housing providers to take up more of a percentage of the provider relief in phase 4 this time?
You know, it's hard to say, Ben. I think, again, as I look back to what the phase 3 experience was, and really the overall distribution numbers that we're seeing, again, you see about $12 billion has gone out for the fund in total to skilled nursing providers, about $1 billion to senior housing. As you step back, the whole fund in itself is about $175 billion fund. And so really long-term care as a whole is not a significant part of all the distributions. Of course, they went to all healthcare providers, hospitals, Medicaid providers, CHIP providers, dentists, and the like. So I would say it wouldn't surprise me if the distributions in this phase 4 largely track what we've seen overall in the distributions for phase 1, phase 2, and phase 3. But it kind of remains to be seen.
Mm-hmm. And just one last kind of follow up with this question: do higher temporary staffing costs count as COVID related expenses when you're reporting that?
Yeah, they certainly can, and that's something to be really mindful too. I know that there was early on in the pandemic, we were aware of some agency staffing activity that was a little concerning. You know, where agencies were going in and hiring staff away at really enhanced hourly rates, and then billing that back to the facility. And so I just say, again, be super mindful of the terms and restrictions in the distribution formula to be sure that any of those costs you're submitting are in accordance and are reimbursable.
Mm-hmm. And going back to M&A, as we have to, do you think that phase 4 is going to have a chilling effect on M&A activity? Just because we had heard from people involved in deal making over the past year that the first couple of rounds of provider relief, a lot of owner operators that would have been struggling enough to seek an exit got a little bit of a reprieve. Could that happen with this round?
Yeah, I think that's certainly possible. And I think similar to the past distributions of the fund, anyone taking a look at an acquisition really needs to understand, what are the underlying base operations? What do they look like, right? What are the regular go forward expenses look like? What's the quality reputation of the operator? What are the staffing levels? Because you could see this as a much needed Band-Aid, but then of course the Band-Aid will end at some point, right? So I guess it's possible. But again, it's sort of a double-edged sword, right? But for the provider relief funds, several facilities, a large percentage of the market really could have been in even more financial trouble as the year goes on. So in many ways, it might help prop up some operations to be more viable for opportunity here in the coming months. But certainly anyone looking on the acquisition side needs to be mindful of that.
Mm-hmm. And you touched on this earlier, but do you think we're going to have phase 5 provider relief?
I just heard as I came off the conference that it is possible, but obviously it's too early to tell what the timing could look like, what the levels could be. One of the reasons for the delay in the distribution for phase 4, really I would say two things. One is this is the first major distribution of the new Biden administration. We are in October, and we're still considered really as a new distribution. But again, the last distribution went out really in December, maybe early January of 20 and 21 under the prior administration. So this was the first distribution of the new administration. The second is, you may recall during maybe the June, July timeframe, there was some concern that the Provider Relief Fund unspent dollars were going to be swept into the infrastructure package as a pay for something else, a healthcare related need or in a non-healthcare related need. And so there was a lot of work done by all the trade associations and the sector at large to continue to educate the White House and HRSA and CMS and key members of Congress on the need for these funds going forward. Don't use these as a pay for something else, infrastructure or anything else. So I say that because certainly I think people will not forget that. And as we go forward, as funds are then distributed into the Provider Relief Fund, want to make sure they stay there and actually then are then distributed to the proper uses and the needs of the sector. So long way of saying it's hard to know what could happen next, but I know all the advocates and trade associations will be pressing very hard for additional relief because, as we know, the money so far out is it's not been enough largely, right? It's just not been enough.
Yeah, sticking with the infrastructure package, I don't think there's anyone in Washington or outside who knows what the final product is going to look or if it's even going to pass. But I'm curious if the final infrastructure package, whatever it may look like, may have any effect on the senior care industry.
Yeah, unfortunately, Ben, in this current package as is, there's nothing that really I can point to say it'll have significant direct impact to the sector at large. There's about $65 billion in there for rural broadband, and that certainly will help a lot of smaller providers and rural healthcare providers, including long-term care providers. I would say that the greater opportunities would be in the package to follow, to the extent there may be another infrastructure package of what we've traditionally been calling, or they're calling at least this year in DC, human infrastructure. There have been a number of asks already made to help support long-term care operators in the form of upgrades on capital expenditures. Certainly larger and older skilled facilities, moving from those 4 and 3 beds down to 3, 2, and maybe even 1 in some cases. So funding to help with some of those capital upgrades, HVAC systems, cleaning supplies, PPE. Certainly there's a large discussion about creating sort of safe visitation rooms and IT infrastructure for remote visitation and remote telehealth. And so those asks will all be on the table going forward. But certainly I know one thing that's top of mind to the viewers is the staffing crisis, right? And that's all we heard in DC the last 3 days. Some operators even saying that they would take a staff member over a resident at this point. That's how dire the world is out there on the staffing side. And so there are some asks in a package that's been put forth by ACA NCAL and in concert with Leading Age called the Care for Our Seniors Act. And among other proposals inside that package, there's some asks for funding for wage increases for frontline staff, loan forgiveness for those entering into the market, 24-hour nurse staffing, infection preventionists, and so really recognizing what are some things that we can point to help prepare not only for the next potential wave of COVID, but the next pandemic. These aren't just sort of like wish list items. These are infrastructure investments to make sure that operators are prepared for whatever may be coming next. So, but of course, the big crux of that is it's all got to be paid for, right? And I think if anything, what COVID has really exposed is the chronic underfunding of Medicaid for long-term care. It really has. And so I think you'll find that the sector is doing the right things and wants to be doing the right things in the future, but needs help on the funding side from Congress to do that. And so that's really the ask, is to recognize that Congress is in a partnership with the sector. It's the largest payer for skilled nursing for sure, and for some AL. Make the investment that's needed to help prepare for this pandemic. And so I think, again, to answer your question on the pending infrastructure package right now, again, if it were to pass, and whoever knows what size it may be, I saw this morning that Senator Manchin might be willing to go up to 2.2. Anytime you see that kind of movement, there's more opportunity, but who knows what that means in the end. And then who knows what it means maybe for a second package to follow. So I know that all the trade associations are working incredibly hard around the clock in DC to fight for the sector. But those would be some sort of near to midterm opportunities that I would see.
Yeah, I mean, you never hear the underfunding of Medicaid really as part of the narrative when the media is covering the long-term care industry, the staffing shortages right now, which is really, I'm seeing a lot more headlines just in the mainstream on the staffing shortages. And I want to wrap up our conversation with touching on another kind of bugaboo of the media and when it has to do with long-term care, and that's private equity ownership of skilled nursing facilities, takeovers. And this question is kind of more on the government side. Can we expect any more government scrutiny over private equity ownership and takeovers of senior care facilities that could potentially dampen PE's interest in the sector?
Yeah, I'd say, Ben, the activity we saw mid to early last year, especially on the efforts of Senator Elizabeth Warren to really focus on PE, we really haven't heard very much since then, and I think that's largely good news. But that doesn't mean that it's not on somebody's radar and on somebody's agenda. But I think we haven't seen that kind of public discussion like we did earlier last year. But again, that's not to say there won't be some additional scrutiny. I think maybe something for the viewers to be watching for are where states may be going on CHOW restrictions and looking at CHOW requirements in certain states. So it may not be certainly a PE focus, but just sort of acquisition ownership focus. There are a couple states that are looking at some new CHOW packages. So that's something to be watching for, but it's certainly too early to tell to share any details with viewers at this time. But I would say if there's maybe some state-by-state activity on just CHOW experiences overall, that may be something we want to watch really closely and be active for on the advocacy side to make sure that there's not an overreach and overreaction to a headline that someone may have seen at some point. So again, we want to make sure that whatever may be proposed is reasonable and workable and not a gut reaction to something that could be pretty damaging to the sector, actually.
Yeah. Well, Scott, I know we can go all day on this stuff, but I think we just have to wrap it up. I want to thank you so much for your time today. Great answers to these questions, and could be a follow-up coming up shortly. So
I think a lot to be said the rest of this year, and certainly as we enter into the 2022 election cycle, there'll be a lot to talk about. So happy to come back and talk anytime.
Great. Well, we'll be happy to have you. Thanks, Scott. Thanks so much.
Thanks so much, Ben.